Empowerment. Through empowerment, an individual gains control of his or her own destiny and influences the organizational and societal structures in his or her life.
It was appropriate for me to testify because my situation was that I had been an educator for 24 years at that point. My illness had taken me down, had interfered with my ability to be in the classroom, and I had wound up in the hospital 3 times in 1 year. And it's not what it used to be. You know, it never will be. But I'm still doing things that help people. I'm still using skills that I've always had. And I have taken my power back from my illness.
On June 22, 1999, the United States Supreme Court held in Olmstead versus L.C. that the unnecessary segregation of individuals with disabilities in institutions might constitute discrimination based on disability. Institutionalization is the antithesis of integration and an extreme form of segregation.
So it really is a civil rights issue. Certainly it's a quality of life issue. In general, there are a lot of services and supports that could be available that need to be expanded to provide the needed services for individuals who are right now living in institutions or who are in some kind of living arrangement that's not completely independent or integrated into the community. A lot of us in the service world were trained in a certain way, and it's not always as conducive to what folks really need as when we get out there and we work with people one-on-one and we learn what their interests are, what their feelings are about their illness, about their coping skills. We know that there are a lot of barriers to moving people and just to moving the whole idea that people can and should be living in an integrated community setting. And so it makes it really clear that we have to work together, that with anybody who's going through any type of trauma or illness or event in your life, you know, you like to talk to someone else who's been there and can give you their own perspective, even if their whole circumstances aren't exactly like yours. And so that's why peer support specialists or peer mentors or whatever are so important to this.
New approaches to therapy are necessary to promote and support recovery.
I would, encourage providers who are not yet providers to really get a handle on what motivates them to go into a helping profession or a helping situation, and really understand whether it's about them having all the answers, if it's about them and their ego, or if it really is their willingness to be a student and to work collaboratively with people who are in a very different place perhaps than they are or ever have been. As a provider, as a clinical social worker, the pressure to produce, the pressure to achieve outcomes, the pressure to identify goals and objectives oftentimes far outweighs these things that I'm talking about. And we've really, as a profession, and I mean primarily as a social work profession, at this point we've moved far away from that, and I think we need to revisit it. And the consumers know that. People who have gotten on the other side, so to speak, and have moved from mental illness and into recovery at various stages throughout their life, they understand that and they know that. And when I speak to them, that's what sticks out in their memories of their experiences with providers. It's not that they achieved the goals and objectives on their individual service plan necessarily. It was that that police officer took time with me and understood me. That nurse talked to me and understood me and said I was going to be okay. And that social worker, helped me to see, my pathology from a strengths-based perspective for the first time. And from that, I felt healthy, like I could do this thing called recovery.
Cognitive Enhancement Therapy, or CET, is an integrated approach to the enhancement of neurocognitive and social cognitive abilities. This evidence-based treatment is meant to jump-start the brain and improve the negative symptoms of severe mental illness. It is sometimes described as physical exercise for the brain. Just as physical exercise is good for the body, science shows that it's also good for the mind.
Lots of people who are diagnosed with a severe mental illness have trouble with concentration, with attention to task. There's a bit of a delay in reaction time. Everybody pretty much universally report short-term memory problems. They can't think the way they used to. Their thinking is slowed. Their thinking is inflexible or inefficient. And so CET attempts to kickstart or restart that development in neurocognitive and social cognitive ways at a truly biophysical level. I mean, what we're really trying to do is strengthen neuronal connections between neurons in the brain that are responsible for these tasks that people find difficult.
The education of law enforcement officers in crisis intervention training has become an effective evidence-based practice across the nation. Kentucky has adopted the very successful CIT Memphis model. Others, like Ohio, have borrowed from the Memphis model and gone on to customize their program to suit the population they are serving. Both programs have incorporated the use of people with mental illness to assist in the training. These programs are helping law enforcement officers to understand why people act differently when they are in a psychiatric crisis.
I find officers telling me, as I look back on what I used to do, I could see where I was making the mistake. Or some will say, as I look back on what I used to do, I can see that, yeah, I was doing that right, or that makes sense to me now, why that works. Or I didn't know that people who are depressed there's a chemical thing that's going on that's preventing their brain from absorbing or registering or dealing with the world in a way that a healthy brain does. And so they're going to think differently, they're going to respond differently, they're going to process information differently. Somebody who's hearing voices, officers told me how frustrated they were at trying to deal with somebody who's psychotic and hearing these voices. And then when I explain to them, and actually we do some things sometimes that try to reenact what it's like to be hearing voices, they go, oh, so now they know if they're dealing with somebody who's hearing voices that they may be one voice among many.